Welcome to my presentation based on multicultural counseling competence for counselors and therapists of marginalized groups. It is important to understand and be empathetic to the fact that certain reactions are likely a result of cumulative years of prejudice and discriminations among certain groups. Stereotypes by socially marginalized group members. Many issues occur based on stereotypes that various racial ethnic groups hold towards one another. Counseling the culturally diverse. This particular subject has taken on controversial issues and topics. It is always important to remember cultural competency and cultural humility objectives are equally applicable to all therapists and clinicians from marginalized groups. Politics of interethnic and interracial bias and discrimination. Some examples. Feminists have acknowledged difficulty relating to men whom hold a strong tradition about female roles. A second example of bias and discrimination would include LGBT groups describe a negative reaction to straights who voice their beliefs about LGBT relationships. There is an immense history of political relationships between groups of color. Some examples are African American and Asians, Asians and Latino Americans, Latinos and Black Americans, African American and whites, Native Americans, and Black, Latino, and Asians. Difference of racial ethnic groups. It is important to recognize and understand that groups of color may hold values, beliefs, and behaviors unique to their own culture. It can also include a difference of worldviews and communication styles, different views of therapy based on non-cultural stigma, and groups' historical experiences. Difference in cultural values. White Americans typically believe that people have mastery and control over the environment. They also adhere to the value of individualism. As to Asian, Natives, Blacks, and Latinos, maintain values of collectivism, which are the needs of group, family, and communities. Persons of color typically believe that people and nature are harmonious with one another. Additional examples include Asian American cultures. Respect is shown by talking unless spoken to and not making eye contact with the elder and respected person. As to an African American culture, avoidance of eye contact is an interpretation of a sign of disrespect. And communication styles are differently used according to one's culture and can impact the expectation or responsiveness of clients from different backgrounds. Communication styles may include unconcealed verbal communication. They may happen between two people, but may also include nonverbal communication, which would be through body language and tone of voice. Both of these communication styles are very important. Couple examples include African American communication styles tend to be direct, passionate, and forthright. However, Asian culture highly prizes a person in directness in communication as it is considered a sign of respect. Native Americans, example, likely to speak softly and use indirect gaze. Dynamic combinations. Counselor of color with white client. 1. Challenging the competency of counselor of color. 2. Needing to prove capability. 3. Viewing the counselor of color as a super minority therapist. 4. Dealing with client expression of race. Challenging the competency of a counselor of color. Going back to number 1 on previous slides, whether a white client is aware or not, they might directly or indirectly engage in maneuvers that challenge the credibility of the counselor of color. They might question the counselor's capability and insight. Now let's look at it in a different perspective. How about a counselor of color and a client of color? Some of the challenges may include over-identification with the client, encountering clashes in cultural values, receiving and expressing racial animosity.